A new investigation in the New York Times finds Planned Parenthood clinics around the country are facing complaints of low-quality care and poor morale among employees amid financial strain. The paper reviewed clinical documents and legal filings and also conducted interviews with more than 50 current and former executives and medical staff and found that clinics suffered as national leaders prioritized the fight for abortion rights over finding ways to provide patients with sustainable health care. Joining us now with reaction is the president and CEO of the Planned Parenthood Action Fund and Planned Parenthood Federation of America, Alexis McGill-Johnson. Also with us for this conversation is the co-founder and CEO of All In Together, Lauren Lader. Good to have you both with us. Alexis, first of all, tell us what's going on at these clinics across the country and what can be done given the current environment.
Well, thank you, Mika, for having me here and allow me to address this, I think, quite frankly, irresponsible piece of journalism. You know, I have such admiration for the workers of Planned Parenthood at the 600 health centers across this country. People who get up every single day, they walk through protesters, they walk through, potential violence, and they see patients who are traveling all across the country, quite frankly, to get the care that they need in this moment. So they are the heroes here. And what we are seeing now is we are living in a public health crisis, right? I mean, that one that was created by the, first Trump administration. And we are seeing that these folks are trying to provide care in a system that has very inequitable reimbursement rates. And so the idea that Planned Parenthood is in crisis without the proper context, cherry-picking 5 anecdotes out of the 9 million services and patients that they see all of the time across this country in annual visits, it just really felt, just like an unwarranted attack.
Well, and then I'd like to take it a step further. Your answer here, pushing back a little bit to this article, what is it about the system as it stands right now that is impacting care? What are the challenges that Planned Parenthood is facing in this political environment?
Well, I think Planned Parenthood, like all systems, are facing increasing health care costs, right? I mean, I think that's the reality across the country. And we see 50% of our patients are Medicaid patients. They're insured by Medicaid, which means they are coming and oftentimes getting very crappy reimbursement rates. And I would say the problem is really reimbursement equity as it relates to gender. And fundraising alone cannot close the gap that that our health centers are experiencing. And so, I think the challenge, right, is to ensure that Medicaid reimbursement gets increased. And the real challenge in this administration, right, is the fact that, we are potentially under a Medicaid defund as forecast by the Trump administration and those who are advising him. So we have a lot of concern around what could happen there.
So what is your response, though, in light of all that we've just said, to those who do say that the organization is sometimes prioritizing politics over patients?
So our political dollars are raised in the political, in the political entities, right? And we are all fighting to ensure access for abortion rights. And I'll give you a great example, right? This weekend, right, after the voters in Missouri voted in November, this weekend we were able to provide our first abortions in Missouri. Okay, that was a function of our ability to fight politically and ensure that the care is allowed to be provided. Our healthcare is politicized, and so without engaging in politics, we aren't able to actually engage there.
So, Alexis, I think Americans don't quite understand the extent to which we have these healthcare deserts all over the country, and especially in states where abortion has been banned, we've seen just a massive erosion, not just obviously of abortion care, but just basic health care for women in those states. Can you talk a little bit about the services that Planned Parenthood continues to provide, especially in those states? Because I don't think everybody even knows that they're still operating in those places, at great challenge, obviously, to
Absolutely.
care.
I mean, people come to Planned Parenthood for abortion where they're able to get it, or navigation out of state where they are unable to, but also birth control, family planning, STI testing, gender affirming care, which is also under attack. And, for many communities, Planned Parenthood is the first resort, right? It is the first point of entry into the healthcare system. And so, look, all of the work that we do rests on our ability to provide local health care and to also fight for that care, because we know, as I said, it is politicized. So, look, I think the things that people can do are to support their local, Planned Parenthood affiliates to ensure that they're getting those resources, and, to also be a part of a movement to fight for reimbursement equity, to fight for, reestablishing rights that have been lost and are really tragic for communities.
President of Planned Parenthood, Alexis McGill Johnson, and CEO of All In Together, Lauren Leader, thank you both. Please come back. It's great to talk to you.